I'm Maja Relja, professor of neurology, Medical School, University of Zagreb, involving for a long time with movement disorders, and now working a little bit more particularly on dystonia, and also involving with Dystonia Europe from the very beginning when we started and formed our European group in Italy more than 20 years ago. And right now, actually, I'm involved with one very particular project that we started around Europe, named it Dystonia Survey. It's involving of the survey around Europe. We put this validated questionnaire that actually consists of 3-part and 30 questions. We translate it in 24 European languages and post it at the Dystonia Europe website, namely asking patients all around Europe to answer the questionnaire. Questionnaire mainly is focused on some general questions about the patient. Then there are dystonia, type of dystonia, and disease duration, treatment, and so on. One particular and very interesting things about the questionnaire is how long did it take to obtain a correct diagnosis after the first symptoms appear. And the second most important one is how long did it take for example, general practitioner, family doctor, to refer patients to the specialist. And then, of course, after that, how long did it take to receive treatment that it's suitable for that patient, how they are satisfied with the treatment, and how the dystonia somehow affects their life. And now we have actually more than 3,000 responders, and from all over 30 European countries, and obtained some very interesting results. And now this is actually making, let me say, a big noise around Europe, because there are so many or big percentage of patients that actually waited more than a long years to obtain the correct diagnosis. Only, for example, 16% of them obtained diagnosis in the first year. The other interesting thing is that for some of them, their family doctors never recognized dystonia and never referred them to a proper specialist. And the lucky ones have been those who have been referred to a specialist, although they didn't realize that they are having dystonia. So this means that a big percentage of patients waited for a treatment for a long time. And when you see that, according to answers, that dystonia affects in more than 50% of patients their family life, social life, working life, but in 34% of them affects all aspects of their life, then you could see how important is the things that we found out that actually they waited for diagnosis and for treatment so long. Especially today when there are treatments that are effective, like botulinum toxin, especially for focal dystonia, then DBS for generalized dystonia, and so on. So when we are thinking about the reason, one of the most important things is that we actually need not only more awareness around Europe, but that we need actually teaching or education not only to neurologists, but also to the family doctors and primary physician. Our results from the questionnaire today that actually mostly came from the patient experience is a consequence actually of those missing education. So probably how one could solve it is that we need more education, more coordination, more collaboration around countries. And actually we can say that these 3 dystonia training schools that we have been performed in collaboration with COS have been very useful thing, and probably even in the future there is also one thing that one should consider to be actually investigated or organized again.